You as a nurse are one of the key healthcare professionals involved in handling biological drugs and keeping patients safe. This is a short video from the Real Hope Consortium on how to handle biological drugs at your workplace. Biological drugs are sensitive. Protect them from exposure to temperature outside the recommended range. Avoid shaking, dropping, and do not expose them to light. Do not drop or expose to light or temperatures outside the given range of the product. Do not transport through pneumatic transport systems if this has not been validated for the product. Do not drop or expose to the light or temperatures outside the given range of the product. Do not transport through pneumatic transport systems if this has not been validated for the product. Store the drug at the temperature given in the information leaflet. Store it in the original packaging, including the outer packaging. Be sure to monitor the temperature at the place of storage to be sure that the temperature is in the right range. For biologics that should be refrigerated but not frozen, avoid placing the product near the freezing wall of the refrigerator. Avoid storing the product in humid refrigerators. The package leaflet contains a lot of important information, such as how to use the drug, side effects, and storage conditions. Here you see an example of a leaflet for Herceptin. Close to the end you find storage information, such as store refrigerated, which means between 2 to 8 degrees Celsius. There is also information on how long you can store the drug after you have made it. In this case, max 24 hours after preparation of the drug. The preparation of biological drugs can differ, so pay close attention to protocols when compounding. There are also a few things that you always should do. Use aseptic techniques when compounding. Check for compatibility issues with the solutions and medical devices used for compounding, for example, closed-system drug transfer devices, syringes, and plastic bags. Check for the occurrence of turbidity or particles in the solution after preparation, as this might be a sign that something is wrong. However, for some drugs such as dispersions, this is expected and thus not a problem. Do not flick the syringe or drop the preparation because this can create particles in the solution. Do not shake as this can produce foam and bubbles. Avoid mixing different drugs in one bag or using the same syringe for several preparations. Dr. Matthias Paulsson, who is a hospital pharmacist from Uppsala Academic Hospital in Sweden, will now take you through the key things to consider when compounding a biologic medicine that is in the form of a lyophilized powder.
To start, assemble all the materials needed, check that you have the right diluent and review the compounding instructions. Fill the syringe with at least as much air as you plan to fill with diluent. In the video, a diluent in a bottle with a Luer lock is used. By injecting air into the bottle, you will easily be able to withdraw the correct amount. Control that you have withdrawn the correct amount and that you do not have air bubbles in the syringe. Carefully attach the needle to the syringe and inject the diluent into the vial containing the lyophilized biologic. Do not inject forcefully. Instead, let the liquid flow gently over the wall of the vial. Do not shake. Instead, dissolve the powder gently by rolling the vial carefully between your hands, as demonstrated here. You can also swirl the bottle. Check for particles before injecting into the IV bag. When you inject the solution into the IV bag, switch to a new syringe. Clean off the injection site on the bag with disinfectant. Make sure that you have the correct amount of drug in the syringe before injecting. Remember, do not flick. Check to be sure all the solution has been injected. Be aware that some of the liquid is still trapped in the needle. Gently mix the contents of the IV bag by rotation. Inspect the IV bag again to be sure there are no particles.
When you administer the drug, follow the instructions provided by the manufacturer or your in-house guidelines. If the product has been refrigerated, take it out of the fridge 10 to 15 minutes before administration, unless instructed otherwise. Check with the patient for previous reactions or allergies to biological drugs and discuss with the prescriber if necessary. Double-check that the biological drug is compatible with the medical devices used for administration. Check for turbidity or particles in the solution before administration. Do not administer 2 drugs at the same time without checking for interactions such as Y-site compatibility. Again, do not drop, shake, or expose the drug to sunlight during administration. Thank you for watching. This was brought to you from Real Hope.
Real Hope, to understand how biological drugs work in real life. It's a collaboration between academy, pharmacies, patients, and industry. Our aim is to give you the best information and education on how to use biological drugs.